All right, now we're going to look at the homeostatic imbalances that result from urinary tract infections. All right, so if you remember before from the previous lecture, we talked about the pathway of how urine is formed. So urine is formed from the nephron, and all the urine is now transported into the collecting duct, which eventually goes to the papillary duct, transported into the calyces, the minor and the major, and then out the renal pelvis. And then from the renal pelvis, now you have the ureter. Ureter then connects what? To the bladder, and then the bladder connects to the outside world via what structure? The urethra. Okay? Now, urinary tract infections, or UTIs. This is a condition, so UTI or UTD, urinary tract disease, or STIs. Any kind of urinary tract infection, it can be a result of multiple things. So it's not necessarily sexually transmitted, right? So, quick question. Are women or men more likely to have UTIs? Usually women. Women have a higher probability of having UTIs. Why is that? Well, it's because of the length of their urethra. So women have a tendency of having a shorter urethra. So because of this shorter urethra, there is a higher probability of them getting infected from bacteria because of the actual proximity of the transport that's taking place. All right, and so when people that have UTIs, what do they experience? Pain, abdominal pain, changes in urine colors, a lot of nitrates and nitrogen waste in their urine, right? And so these conditions are usually followed by other abnormalities in the kidneys, okay? So UTIs, simple bacterial infection, can lead to a lot of problems. So if we want to talk specifically about the renal system here, specifically the renal pelvis and the nephron, there are two conditions that can arise: pyelitis and pyelonephritis. Pyelitis and pyelonephritis. So what are the difference between the two? So pyelitis is the inflammation of the renal pelvis and the calyces. All right, so the pyelitis, so the first one here, is the inflammation of the major and minor calyces as well as the renal pelvis. Pyelonephritis is the inflammation of the renal pelvis, the major and minor calyces, and majority of the nephron. Okay, so these patients that experience UTI that just started out in their urethra, that migrated to their bladder, eventually, if not treated, the bacteria continues to grow, right? That's its main function. If it's not killed, it'll keep growing, causing other pathological abnormalities, specifically in the renal system here. So the first region, if we follow the pathology of the actual pathway here of what's going on, pyelitis is a result because it's involving the renal pelvis. Pyelonephritis results if this pyelitis is not treated, then it can eventually go to the entire kidneys, and this can become very problematic because you have a buildup of fluid, swelling, it can lead to edemas, and also abscess forms. So you have a lot of these abscesses forms. Let's use a different color. So what is an abscess? So abscess is a buildup of pus that is usually a result of some kind of infection. So patients with UTIs or pyelonephritis or pyelitis, what do you think their proper treatment is? So the proper treatment for this is, if it's a pathogen, specifically a bacteria, the proper treatment would be antibiotics. So antibiotics are very useful in helping these problems, right? So some of you that are wondering, okay, I don't want to take any drugs, I don't really think it's worth it, right? And they decide, okay, I'm not going to take my antibiotics. From a simple UTI, you can end up having renal kidney disease. So you have any kind of kidney disease that can result, and eventually, if that's not treated, eventually it'll lead to some kind of renal failure, and eventually you need some kind of transplant or you die. Okay, so this simple UTI can lead to death. So it's really important to take medications and seriously, right? Again, and don't push it off for a second, because again, if you know the pathways of the systems, you'll know where the next step of the actual disease is, right? And so for some of you that ever experience any kind of UTIs, what is the natural home remedy that people always prescribe? They always say drink cranberry juice. Why cranberry juice? Cranberry juice has a natural key component to it. It's called sodium benzoate. So let's put it here. So sodium benzoate. What is sodium benzoate? Sodium benzoate is a natural preservative. So anything that you eat, majority of cases in the American lifestyle, has some kind of preservative of a base of sodium benzoate, right? And we talked about that McDonald's example, right? They grabbed the hamburger from McDonald's and they put it on a table and they left it there for 3-4 months, and that burger didn't change. Right, and I remember people just wanted to actually try it and taste it out, but you can tell from the preservatives, sodium benzoate, perfect example, is probably something that's not necessarily natural, right? Because you want the actual foods to decompose. That's part of biology. If it doesn't, there's something going on. And so in cranberry juice or in cranberries, you can see the same thing. You can leave cranberries out for a long period of time, and they don't really have a tendency of decomposing. Another function of sodium benzoate, besides being a preservative, it's also another natural antibiotic. So it's an antibacterial that destroys all pathogens. Now you're wondering, oh wait, hold on. You just said it was in my McDonald's, and I said it's probably in every other thing that you eat that requires some kind of preservative. So we're naturally eating, not necessarily naturally, but every food we usually eat has this sodium benzoate in it. So what does that tell you? We are basically eating all these antibiotics. Again, it'll prevent us from any kind of UTIs, but at the same time, our gut microbiome is being compromised. Now you wonder why we're getting all these diseases like autoimmune diseases and all these other problems, inflammatory problems before, because they're correlating a lot of these diseases due to an abnormality in the microbiome of the colon. So how UTIs can lead to all these other problems is really important to take seriously of what's going on. And again, antibiotics, again, it's all relative on when you take some kind of drugs, okay? So antibiotics in this case is a very effective drug of reversing these problems and treating the patient.